Welcome back to Senior Care Today, Life Programs of Southwestern Pennsylvania. Right now, let's welcome Dr. Brent Nickisher and Dr. Sean Eubank, who are going to discuss medical and medication issues of senior life, which I imagine can get pretty complicated as we age. So what is the difference then between the care that someone would get at a typical doctor's office and the care that they would get through the Life program?
Okay, if we think about our typical senior citizen who requires extensive medical care as they age, their medical conditions get worse with time. They usually go see their family doctor every 3 months, every 6 months, depending on their needs. After they get evaluated by their doctor, they usually leave with a prescription and some recommendations and their wish the best. The difference in a Life program is that our care is much more integrated in a team and much more comprehensive. The ability for a senior to see a doctor or see an on-call nurse any time of the day or night is absolutely essential if something should change in their medical condition. Our programs are an alternative to nursing homes. So if you take a senior who might have some heart or lung conditions and they would like to remain in the home, maybe they're having a little bit of dementia and their family is providing support, but their goal is to stay in the home. Our team, which is an interdisciplinary team of nurses, doctors, physical therapists, social workers, dietitians are all available to help them meet the goal of staying in the home and avoiding a nursing home or a hospital. So it's very unique. We follow them home and provide 24/7 access to care.
So this then really cuts down on the number of, let's say, hospitalizations they might need, or maybe trips to the emergency room, which is again a big issue when it comes to those who are aging.
Yeah, and there's a couple specific reasons for that that are very important. First of all, the average family physician or internist might have several thousand patients in their practice. With our Life program, our participants get a lot of individualized and specialized care from their physician and other members of the interdisciplinary team. And the reason is because our doctor to patient ratio is much smaller. The average physician in a Life program might only have 100 participants, so you can give much more detailed, specific care as situations may arise needing care.
So tell us then about the types of specialties that are available.
Sure, Shelley. The Life programs contract with a complete panel of specialists. So if we have members who see cardiologists, pulmonologists, diabetic doctors, dermatologists, surgeons of all types, we contract with a complete panel to provide that care. And in addition, we contract with ophthalmologists and dentists, also podiatrists, so we can provide a full spectrum. Now, it doesn't stop there. The doctors in the Life centers collaborate very closely with the specialists so that we can review specialist recommendations, we can sit down and talk with our patients, we can come up with a care plan that matches what the patient wants and what the specialist is recommending. So everybody has an agreement. It's a very good process. It works out very well.
Now, do most people realize that this is even available? I mean, when you just mentioned all of the specialties and the opportunities for people that they could have in their home, I mean, that's pretty impressive.
Sure, and I think these programs are growing in popularity. Right now, PACE programs are about 135 or 36 across the country. They're not in every state. Some states have multiple programs. But they do provide a level of care which is really unequaled. Our members have complete physical assessments every 6 months. Their care team is not just a doctor in a doctor's office, and this is really important. Our teams are made of physicians, nurse practitioners, registered nurses who really help manage our members through the process. But we also have physical therapists, occupational therapists, speech therapists. We have dietitians, and we have activities coordinators. We have social workers in our buildings to help our patients that have non-medical issues. So we really have a team that really moves in with our patients. We go to their homes and we care for them. We have access to care 24 hours a day. They can contact a nurse. The nurse can contact the doctor. It's a very comprehensive home for medical care.
What a wonderful opportunity for people. Let's talk, if we could, briefly about medications. Obviously, different doctors are prescribing different things. How do you avoid unnecessary issues?
You want to take that?
Medications are obviously very important. There's a lot of medical conditions that require medications. They're small life insurance policies to some degree. And we take a lot of time to educate our participants and make sure that they're compliant with their necessary medications. Oftentimes, there's a problem in that too many medications are prescribed, and that can cause problems as well.
Right. So it's not unusual for our patients to come into our program on 15 or more medications. And we try to make it a goal to look at those medications carefully, try to decide, are the medications effective? Are they prescribed for the reason that they're taking them? And are they working? And do those medications interact? And we know medications, if a patient's taking more than 5, they're having an interaction with their medications in some form. So our goal is to look at those medications, look at their doses, and make changes to their medications. We do this in close conjunction with the patient. We also talk with specialists. So if a specialist recommends a medication, we can look at that recommendation, we can look at their other medications, and we can talk to members about is it appropriate for them. Importantly, we have a centralized pharmacy which provides medications, and as the physician, I know all of their medications a patient is taking, and we deliver those medications to the member's home. And our nurses check them so that we know the members are taking them. We have a very close idea of what's happening there.
Very comprehensive
Right.
and wonderful for the patient. Dr. Nikisher and Dr. Eubanks, thank you. And when we return, Bridget Hartnett of Life Pittsburgh will discuss day center activities and meals. That's all coming up next when Senior Care Today, Life Programs of Southwestern Pennsylvania continues.